The main impacts of the Fast Track Cities GP Champion pilot so far have been up to a 31% increase in testing across London. That's through pop-up events that the GPs have held, but also incorporating testing into cancer referral pathways, over 40s health checks and opt-out testing in TB clinic in South East London. They've also managed to implement the new statin guidance for people living with HIV into local guidelines. There's been a 56% increase in statin prescribing in North East London. We've been tackling stigma and improving HIV awareness across all primary care staff in partnership with HIV Confident from the National AIDS Trust and the HIV Ambassadors from Terence Higgins Trust. In Croydon alone, that's resulted in 60% of Croydon practices signing up to the HIV Confident Charter, and across London there's been over 400 people attending an HIV awareness educational event. Improved communication between primary care and HIV services, and the partnership working with voluntary sector organisations and GPs as well. The pilot's ongoing, and the work that the GP champions have been doing with the teams around them will have a lasting impact.
London HIV GP Champions programme was incredibly important. For many years now, we've heard about the need for further GP education to help support integrated care for people living with HIV. But of course, now we also have opportunities to increase access to HIV prevention technologies, particularly for populations who've usually not been thought of as high risk, if you like, in addition to the traditional high risk populations. We hear from patients, people who are at risk of HIV or people living with HIV, that they sometimes encounter issues in primary care, either with stigma or with people not being up to date on HIV knowledge, and then a reverse criticism from some of our primary care colleagues that those of us who are HIV specialists have sometimes kept our patients to ourselves, kept some of the knowledge maybe a little bit secret. And I think really there's been a need to bridge those divides and make sure that we support colleagues in primary care, form good communication networks, help them with destigma training, and help them share this knowledge with their colleagues so we can provide better care to a wider range of people in different healthcare settings.
And what this programme has really done is it's really tried to break down those barriers through education, through reaching out to people within practices, through the HIV Confidence Charter Mark, also to increase HIV testing and HIV awareness. And the other, which has been just fantastic, is the way that we've communicated between ourselves. We're no longer working in silos, we're actually working together to get a better patient pathway and better patient outcomes, and working out ways that we can do that, which I just think has been phenomenal.
As we approach our national ambition to end HIV transmission in England by 2030, it will be so important that all of our services are integrated to provide the most holistic, high-quality care for people living with HIV. And this is so important because we're dealing with an aging cohort of people living with HIV. People who may be newly diagnosed with HIV will be dealing with a multitude of social health issues that requires a much more holistic approach to care. And that's why programs such as the GP Champions program really brings the best of primary care with the best of HIV treatment services. It's the future of HIV care. It's what's needed for the epidemic today, and it's certainly a core part of doing best for people living with HIV.